Hi, everyone. Welcome to Tuesday Tips. We are live with Your Nurse Advocate Consulting. Hi, I am Pam, and I am one of our pair of Your Nurse Advocates, and my partner is Linda. And we look forward to tonight's Tuesday tip. So we're making Medicare plan review simple and stress-free. Just 15 minutes, and you'll know exactly what you need to do. And I want to preface this by saying we've been doing a lot of Medicare things. Open enrollment or annual Medicare enrollment begins tomorrow on the 15th of October and runs through the 7th of December. And I know this is a terrible time. I am of Medicare age. And so I hate all the texts. I hate, I get all the mail, you get the phone calls and all this stuff. And I don't want to be one of those, but this year especially, there's been so many changes in Medicare, changes in plans being dropped, certain insurance companies dropping plans in different counties across different states, and even some healthcare systems dropping certain insurance plans. There's been so much going on that I really don't want any of our community to get caught not having their plan reviewed and seeing if, what's the best way to go for 2026. So bear with me. But again, I just want to make sure everybody is prepared. So let's talk about the 4 key documents that you're going to need to gather and how to use the Medicare website. What special needs you might have, financial or health-wise. What do you need to consider before making any changes? So, even if you love your current Medicare plan, things change every year. For example, we loved our Medicare plan. It's still going to be available, but they're almost doubling our premium for next year, and their benefits are a little bit less. So again, I want to look because I want to make sure, is there something else better out there? Costs go up, your prescriptions might be covered. Maybe your insurance company is dropping a certain medication in favor of a different medication in the same class. And unless you check, unless you review, you won't know that. So if you don't do nothing, you just roll into the same plan you had this year. Maybe you're in the best plan, but I am encouraging everyone to do your due diligence, whether you're reviewing it yourself with some tips we've given you, whether you use us to help review and prepare for an advisor, or you go right to your advisor. It doesn't matter to us. Just please, please, please review your plan and see what other options are out there, and making sure your doctors are still part of network. And we're going to talk a little bit more about that. So costs may go up. Your prescriptions might not be covered. Your doctor could leave the network, as we just mentioned, and new benefits or better plans might be available. And another example of that is in our area, Aetna's kind of stepped up to the plate, which is a national insurance company. And with a regional insurance plan of ours that has been dropping some plans in different counties, it's nice to have another option. So always changing. So the 4 documents that we want to gather is your Medicare card, because if you're going to make changes or work with an advisor, you're going to need to know what parts A, B, D that you have. You need to know this information for the Medicare website or when calling for help. So you want to have your annual notice of change letter. Every insurance company is obligated to send you the notice of changes for 2026. We have gotten ours already. I've talked to some of our clients. Some have gotten them, some have not. But you need to be getting them any day, because they need to send those out. And that is going to be, they're going to, a good insurance company in your notice of change is going to show you 2025 compared to 2026. So you can see side by side what the changes are for next year. So this comes from your current plan every fall. It lists what's changing for next year, premiums, co-pays, covered drugs, and more. Didn't get it? If you didn't, and if you don't get it in the next couple of days, because annual enrollment begins tomorrow, call your plan or check your online account and see if they had sent something maybe to email. The third thing is a list of current medications. Write down every prescription, the dosage, and how often you take it. So here's where some people get into trouble. So I'll give you a very common drug, and this happened with my mom, and I had to reach out to my sister a couple of times. When you have drugs that come in different forms and have the same name, or the same beginning of the name, it's very easy to get confused. And so I'll give you an example. Metoprolol. Metoprolol is used for blood pressure. It's used for a heart protective medication if you have a cardiac history. But there's two kinds. There's metoprolol succinate, which is the long acting. There's metoprolol tartrate, which is the short acting. So you could be taking it once a day. You could be taking it 3 times. So it's really important to know because they're essentially 2 different medications. Same class, one's long acting, one's short acting, but it could make a difference with your insurance company with the dosage and what you're taking. So make sure that you know exactly the correct name for the drug, the correct dosage, and how many times during the day that you're taking it. Number 4, you want to have your list of doctors, your pharmacy, and preferred hospitals. So make a list of your doctors. I know some people, if you have an option between a PPO and an HMO, what is that and how is that different? An HMO, you may have a little lower pay. There's more in-network benefits, cost less, but you have to stay within a network. Now, a PPO plan has a bigger network. And so you can maybe go to a doctor that's not in one hospital and your primary may be another hospital, and they the network is bigger and you have more choices to use. So consider that when you're looking at your doctors or your specialists. So these are really important to have ready when you're reviewing your Medicare plans. So now let's go ahead and let's walk you through, just the Medicare.gov website. So I'm going to bring up that site and I'm going to see if I can go ahead and share my screen. It is actually a pretty easy thing to do. And sometimes I have to go, I should have had this ready for us. It just take me a second here. And I'm going to go ahead and I'm going to share my screen because it is, and I'll drop the website right now into the chat here, into the comments, and this will be on the replay as well for our video. So let me go ahead and put that in there. This is the Medicare site where you can go and start looking at plans in your area. And I'm going to kind of walk you through that a little bit. So there you go. That's in the chat. I'm going to put it on the screen there just for a minute. This is the website for Medicare.gov /plan. And that will be for your to check out your Medicare plan. So let me go ahead and share my screen here. And let's see. Share screen. And let me go to the Medicare one. So I'm going to share that. So here we go. So this can be very simple to do. So don't feel intimidated, or if you need someone to help you on the website, this is an easy way to go. So here's review your 2026 plan options. So first thing you do is, obviously, we're going to be looking for 2026. I'm going to use my zip code just as an example. So that's 54619. And it's going to ask me what county I'm in. So I'm in Monroe County. I'm going to go ahead and click continue. And next, select the type of plan. So are you looking for a Medicare Advantage plan, which might have lower monthly payments? You might have a little higher costs if you go in the hospital, or drug plan if you're looking for Part D, or if you're looking for a Medigap policy, which is like a supplement. So higher upfront costs, but then they may cover more in hospitalization. So this is something too that's great to talk with us or talk with your advisor on which would be the best plan for you based on your finances and your health history. So I'm going to check Medicare Advantage plans because that's what I'm interested in. And I'm going to go ahead and click Find Plans. So here's just a question here. Do you get help with your Medicare health and drug costs? Do you have Medicaid? In Wisconsin, we have a plan called, now it's eluding me, and I'll probably think of it in a minute, but it is to help with drug costs. Are you getting supplemental security income? Are you on a Medicare savings program, or extra help with drug costs? And it's not even asking you for a plan name. You would check that. So I don't. So I'm going to check I don't get any help from these. Do you want to see your drug costs when you compare plans? Yes, I do. To see drug costs, get ready to enter the name, dosage, quantity, and frequency of your drugs. So here's where it's real important for your drugs. So I do, so I'm going to correct that. I do want to see that, so I'm going to hit next. And I'm on one medication, and that's a blood pressure medication. And so I'm going to go ahead and put that in. And then it's going to ask me what my dosage. I'm going to put that in. I usually like to get 90 every 3 months. So I'll go ahead and do that. Add that to my drug list. So that's the only drug I have. So I'm done adding drugs. And now pharmacy. So I like to use Walmart pharmacy in in Sparta. So the location is Sparta, Wisconsin. So that's where I like to do. So look for pharmacies. Make sure that you when you're choosing a plan, your pharmacy will be in network. So I'm going to click on Walmart, add pharmacy, and you'll see down here on the bottom, that's added to my search to my plan, and then done adding pharmacies. Now my doctor, so you want to here's where you put your primary doctor to make sure that it's all of these things are making sure that they're going to show you the plans, that with your choices. So I see Dr. DeBoer Collins, and first name is Christina, and it is DeBoer Collins. And so I'm going to search for providers, and did I not spell it right? Because I've done this many times, and it's let me see. I'm going to take out the DeBoer because maybe I spelled that one wrong. And 54619. This is really weird. So this is weird. So bear with me. There's always a glitch somehow. And it's still not. So this is back to drug and pharmacy. So I made a mistake here because I just did this the other day and it came up with several plans. So I'm done adding drugs, done adding pharmacies, provider, Christina DeBoer, maybe it's EOR. No, it is OER, I'm sure of it. And let's see, it's still showing none. So I'm going to hit Sparta Clinic and see if that comes up. And no. So let me put in another doctor's name. Let's see, Dr. Leyland. That was my last doctor, just to get us moving here. That was Christopher Leyland. And so he comes up. So if I want to go ahead, if that's my doctor, I'm going to go ahead and click that provider, continue to view plans. And here's where your homework starts. So on the bottom, they will ask you if you want to, you can click on a button, and I'm going to see here, right here. See this button? It says add to compare. If you click that, it will let you choose, I think, up to 3 different plans. And then at the end, when you go through it and choose 3, it will side by side give you that comparison so that you can see that. So they usually start out by the cost of the premium per month. And so they usually go through the 0. It's real important to make sure that you're looking at your deductibles, your in-network, out-of-network, the Aetna. So this is the free or the no-cost premium. You know, it has a $5,900 in-network you have to meet. There's a Quartz that has a $6,700. ARP is, I want everybody to know, ARP is United Healthcare. So if you're in an area where, and we've been seeing this in Wisconsin across the country, if you're in an area where some of the systems are no longer going to take United Healthcare, be aware of this ARP plan. So that's another important thing to talk to your advisor about, and to call your clinic as they're renewing contracts. Ask. They might give you to the billing department, but say, hey, are you renewing your contract with United Healthcare for next year? So these are real important things to know. So they're going to, this is the plan that actually we're looking at. And it says it does not include my provider. So I'm going to go ahead and click on that, and I will add, and I know for this Aetna, it was included. So, but yeah, so you just need to go through all the plans and begin to narrow down, by putting in your drugs, that's going to help you on the side here. This is the plan benefits: vision, dental, hearing, transportation. It's going to give you kind of the down and dirty so you could look at the providers. So this is going to be important for you. So I'm going to go ahead and stop sharing my screen. And I just want to continue, but I just wanted to say that that's a government, a Medicare website. So they're unbiased. They're not going to share any preferences with you. They're and nor would we. And a good advisor, I'll tell you, I've interviewed several advisors, and I'm very excited to say that the one that we've been sharing some information with, we feel very comfortable. So we can also help with that if you don't have an advisor and would like to look at one. So let's go ahead. And so as you create a free Medicare.gov account to save your info, even if you don't finish it, you can click the save button and they will email you a code so that the next time you go on the site, you don't have to start all over again. You can just pick up where you left off. So when evaluating your plan, don't just look at the price, think about your unique needs. So one of those things would be financial. Are you on a fixed income? Are you looking for plans with lower out-of-pocket costs or extra help programs? Or, maybe check to see if you qualify for a Medicare savings program or extra help. And that's what would be like a Medicare Advantage plan. They would call that a dual plan, a Medicare/Medicaid plan, if that would be something that based on your financial situation, you may qualify for. Again, another good question to work with your advisor on. Your health needs. Do you have chronic conditions like diabetes, heart failure, COPD, chronic obstructive pulmonary disease? Some plans offer special disease management programs. You can get some extra care coordination or lower copays for certain conditions. And also make sure your specialists and preferred hospitals are also in network. You need to consider travel or dual residency. Do you spend time in more than one state? Some plans have limited networks. So here's where that HMO versus that PPO can come in. So an HMO is very regional. A PPO is more worldwide. Like if you're going with a national company, such as Aetna, Blue Cross Blue Shield, Humana, things like that, they would have a PPO network that might be all over the country. So if you live, if you're a snowbird and live for a few months in another state, that might be an option for you to still continue to have in-network benefits. So lots of things to think about. So make sure you're covered wherever you go. Make sure your plan covers you if you leave the United States, or at least a minimum that any emergency is going to be covered when you're traveling outside of your area. And then look at future needs. Are you expecting any surgeries or major health changes? Maybe consider plans with lower out-of-pocket maximums or better coverage for hospital stays if you're anticipating that. So lots of things to think about and mull over, so to speak. So I've put in the, I'm going to go ahead and I'm going to drop it in again. I'm going to go put the website in the chat again for us. So let me drop that in there again so that everybody has that. This is the Medicare.gov Plan Compare. And this is your website where you can go to compare the plans. Like I said, that is taken care of for us from our Medicare government. And then here is another, there's state insurance. I'm just going to go ahead and drop these in the chat as well. And they'll also be in the just the video description on when we share this on the replay on our YouTube channel. So I'm going to go ahead and just drop the rest of the resources in here for you so that you have that. I'm not going to show them on the screen, but like I said, I will include them in the video description for our replay on our YouTube channel. So these would be some more resources that you could get some assistance with figuring out what would be the best options for you. So in closing, remember Medicare and annual enrollment ends December 7th. So please don't wait until the last minute. Gather your documents, set aside 15 minutes, review your plan, play with the Medicare.gov site to look at what plans are in your area. One plan might be in your county, and then someone else, like you might have a friend that lives in another county, another state, and the same plan might not be available for you. So that's why it's really important that you do your own due diligence, have a family member help you, reach out to us if you need to. But gather your 4 documents, set aside those 15 minutes, review your plan, and your future self will thank you for that. So if you found this helpful, please like, share, tag a friend, subscribe to our YouTube channel for the replay. And whoever needs maybe a Medicare checkup this year, reach out and share this with them. And if you have questions, drop them in the comments, reach out to us directly, or send us a messenger. And thank you again for joining us live for Tuesday Tips. And we'll see everybody back next week for another edition of Tuesday Tips. Take care, and we'll see you soon.